I vividly recall about a year ago going into each emergency room shift with this unprecedented level of anxiety and fear about what COVID-19 was doing to patients and ripping apart families. I remember walking through the hallways, hearing patients on oxygen tanks, with my colleagues and myself running around, not knowing exactly what treatment options we have available to us. I remember as a health system, we were adapting quickly to figure out new protocols. But I do recall that this year has been one unlike any other, and one that we really do need to use as a learning lesson moving forward. We have learned the importance of coordinating state, local, and federal initiatives. We've learned the importance of having guidance from organizations like the CDC, and we've learned about the importance of really acquiring strong scientific evidence that can be backed by science and that can be implemented in the clinical setting so that we are able to face significant uncertainty, the kind that we face with COVID.
It is difficult to say with any great precision about exactly when it entered the UK borders. It's very likely that there would have been cases of infections just around the same time that we would have seen reports coming from elsewhere in Europe. However, knowing earlier, I don't think would have changed the course of the pandemic, because once they were detected and confirmed, the government went ahead with the flu pandemic strategy.
What is really astounding over the past year is just the speed at which these vaccines have been able to be licensed. And the reason for that is the massive collaboration within the scientific community. But also there hasn't been any delay in waiting for approval, for funding, for clinical trials, for ethics. Everyone that has been involved has really said, please get this done quickly, get this done properly, and you don't have to wait for funding. Here are the resources that you need to do that. And that's really the key difference between this vaccine development and other vaccine development.
We need to get those vaccination rates much higher. We will get there. It just won't be before June. And the idea of face masks is something that we might have to start to really get used to, particularly seasonally.
We're hoping that the vaccine reduces all of the severe cases and certainly greatly reduces all of the deaths from COVID. But in terms of mild or moderate cases, we may still see an increase, especially when it comes back round to winter and people are spending a lot more time indoors and closer to people. And that's really one of the reasons we see this uptick in cases of things like the cold and the flu and other respiratory viruses around winter time. So we may be looking at not just a cold and flu season, but a cold, flu and COVID season.